Hello and welcome to CDO Magazine interview series. I'm Baz Kuti with Modak, and we're partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in a series of interviews. Today I have the pleasure of talking to Gaurav Shah, Senior Director of Analytics at Sanofi. Gaurav, good to meet you. So to start as kind of introduction here, your role and what Sanofi does, if you just want to set the scene here, and then we'll go into the more detail around the roles and so on. Okay.
Absolutely. So first of all, thank you for this amazing opportunity to talk with you and to share my thoughts and my experiences. I'll begin with a quick overview of Sanofi, if I may, and then I would share more about my role, to begin with that. Sanofi is a global healthcare leader headquartered in Paris, in France. We operate in more than 160 countries, and we have about more than 100,000 people as employees. We have three core business units, global business units: specialty care, which includes rare diseases, asthma, atopic dermatitis, vaccines, which is primarily our flu vaccines, and general medicines, which includes our diabetes and cardiovascular and other pharmaceutical products. We also have our consumer healthcare business unit, which will become a standalone unit soon. And this includes, our heart products like Allegra, Gold Bond, Icy Heart, and so on. So at Sanofi, our motto is simple. We want to empower life by giving, people the opportunity to live life to the full potential. And as for me, I can give a quick introduction for myself and what I'm doing at Sanofi. I did my engineering in information technology, and I have worked in many different industry verticals, including fast-moving consumer goods, energy, retail, food and beverage, automotive, and finally landed in healthcare. So, I have been with Sanofi now on this empowering life journey for the last 8 years as part of our global digital and data leadership team. I have a strong ERP background and data background as well. And basically, I like to call myself as a technology addict, as I'm driven by the possibilities that technology brings in. Me and my team's job is to lead data analytics and user experience for our key global enterprise programs. In addition to that, we are also responsible for the global finance, sales, and manufacturing data warehouse and BI applications. So a lot of data pipelining, cleansing, consolidating, analyzing, and reporting is what we do on a day-to-day basis, working in a multi-cloud, multidisciplinary digital landscape. So on one hand, I have enterprise analytics, and on the other hand, I have designing and transforming our end user experience. So in fact, just to give an example, right now, I have our company's global ERP with real-time embedded analytics on my cell phone, so which was made possible with my team. So.
That's a great background on both Sanofi and yourself and the experience you've provided. And as you look at Sanofi and your role and your team, the challenge chief data officers have is really identifying what are the kind of key questions they should be thinking about when they're undertaking digital transformation, data transformation initiative. Obviously, Sanofi's been on this journey quite a bit already. But from a leadership point of view, what are the 3 or 5 things which are kind of key questions as a chief data officer or a chief analytics officer is thinking about and considering?
Absolutely. I mean, that's a very good question, honestly. And I would just like to, start by saying that, a comment on the chief analytics versus a chief data officer. There's always been this conversation. But I would say, if I were the chief analytics officer, I would also like to own the data strategy. So to me, actually, these kind of are combined roles in one particular position, should not be diversified into two. But, being a CDAO or a CDO in a healthcare industry is truly an honor, because you have an opportunity to actually positively impact a human life with data and insights. How amazing is that? Until recently, we couldn't really dream about this and forget about contributing to it. So the number one question that a life science or a healthcare CDAO should address is, how do we best leverage the data we have for improving human life? At the end of the day, this is the purpose that drives us. It could be done in many ways. You could have precision or personalized medicines, digital therapeutics, drug discovery, optimization, clinical trials, or even via supply chain optimization. So there is data everywhere, and this is where the CDAO can really contribute and lead the direction for the organization. My next question would be, what can I do to ensure that our leadership and our employees are able to exploit enterprise data effectively, and generate decision-making insights with complete trust in the data? So it's a bit of a loaded question with a lot of things involved, but I think the most important being trust in data, right? So unless we can prove that the data is accurate, and the insights won't matter. You cannot make good business decisions with bad data, so to say. Now, one of my next question would be, how can we democratize the data across the organization? Now, it's a cliched question, I believe, because democratizing the data, I'm sure you must have heard this many, many times over, but we have to tackle it, and it's a fact. We have to remove data silos. We have to provide clear data management strategy. We have to communicate the value and importance of democratizing the data. Take small but effective steps. Don't try to change everything overnight. It never happens. We tried that. We failed.
Yeah.
So, and last but not the least, how do you bring about innovation that is fully aligned with your organizational strategy? So there are a lot of transformation programs where data plays a central role in these days, and being aligned with the overall organizational strategy is key to accelerate the adoption and to realize a true value proposition using data. So those would be my 4 questions.
Good 4 themes around, kind of the key questions where, as you sort of exploiting data. I really like, how do you use data to make better human
Yes.
life journeys effectively, and then democratizing. But really, all 4 are tied together. If you think about it, they're kind of a ball which interwoven interdependencies across all these as we go
Absolutely.
through. So how do you think either Sanofi or enterprises are sort of taking these questions and leaders and the behaviors leaders are showing, both the business side, IT side, and the digital side,
Yes,
are taking to address them? So how do enterprises now kind of answer these questions, and then what behaviors does a leader need to show so that these questions do address?
No, it's, to me, the number one thing is it's very important for anybody who is going to be a data or analytics leader in a healthcare industry, especially, to know the industry that they are going to work in. So basically, I'm not suggesting that, people cannot move from one industry to the another. In fact, that is absolutely required sometimes to internally disrupt an organization. Just that before making that move, we want to make sure that you as a leader get educated with the industry and the data that is specific to healthcare, because there is a lot to be done here. So one of the key values that I would say that a data leader should have is the ability to articulate in simple words the vision and purpose of what they are going to do and why. They need to be able to create deep relationships and trust with all the stakeholders at local level, regional, global, be it business stakeholders or IT stakeholders in different groups within the organization. They have to make sure that they have these deep trusted relationships created, because that will help avoid the data silos that would come later on, right? The one key characteristics that I would say is never accept bad data. This is one area where good enough is never enough. We must be 100% sure when it comes to data and insights. No compromise there. And one of the 2 biggest challenges faced by the DNA leaders today is how do you embed data and analytics in business results? How do you move from technology centric to data driven, or siloed to common aligned business strategy? So those things need to be addressed by these new leaders coming on board. And it's no longer about dashboards and reports and KPIs. It's more about how do you augment decision making across the business, right? And secondly, change the perception of data and analytics within the organization. So in many organizations, the data analytics team is still seen as a service within IT that creates reports and sits somewhere. It needs to be more than that. It needs to be closer to the business. It needs to be hand in hand with the business strategy. And I'll just end by saying, all the data leaders today should be expert in converting organization strategy into execution with properly defined business outcomes. So that's more I would go with, how the value and characteristics of a data leader should be.
I think is a change. So these questions, to address those questions, those 4 questions, and also look at the characteristics and the behaviors leaders need to exhibit.
Yes.
So simplifying the message, understanding their domain in terms of knowledge. But I think you said a key word, which is augment. Yes. And I think it's not really fully understood yet by everybody in our sectors, because augment really means finding a way where your technology or analytics is your best friend.
Absolutely.
It's a mentor to you. And how do you have your best friend as a coach, as a performance coach,
yes,
who's really articulating the KPI or the value you're trying to unlock embedded into your business process?
Yes.
And
yes.
so I think leaders articulating augmentation to achieve those 4 threads we talked about.
Yes.
Will really bring this together. So, hopefully I brought sort of bringing the worlds together for you and how I see it as well. Yeah. So if you sort of step back from that, where is Sanofi today? What do you say would be today in terms of addressing some of those questions and some of the directions you've just mentioned?
Sure. So, as you can imagine, from my introduction as well, at Sanofi, due to the sheer scale of data and diverse business groups that we have split across multiple data streams. As with other organizations like ours, we have categorized our data organizations by business units and by global functions. So that cut across the business units. So global functions are more horizontal, and then business units are more vertical for us in the data organization. And also, the business models are very distinct when we look at one business unit to the other. So, for example, vaccines is very different than GenMed. Their data needs are very different than specialty care, which is, again, compared to consumer healthcare, it's completely different. So it needs to be factored in when we create this organizational model or structures and things like that. So keeping that in mind, in fact, we recently have a new chief digital officer, and he is driving this challenging task of establishing a global digital and data organization. The idea is, I think it's very common across many organizations as well, to create a hub and spoke kind of model where the business units and functions can continue their data journey, but follow a well-defined common operating model. And this operating model, the number one thing it should include is ruthless prioritization process, which ensures a transparent ROI-based approach, fully aligned with our play to win strategy at Sanofi. And value creation should be at the core of this operating model. So that's where I would say we are going. And that is the next step in our design strategy of how the operating model should work. And within Sanofi, we have a lot of great talent. Honestly, I'm blown away with the potential that we have, not just on data and analytics, but every domain that we work with. And retaining talent is something we take very seriously, and we are very proud of. And we have been consistent and proven to attract a lot of young and experienced talent over the last years. In terms of delivery disciplines, to support data transformation, we still have a long way to go. I wouldn't say, I wouldn't sugarcoat it. We have a long way to go, and as it is for other competitors, so in the same industry. In healthcare, as you can imagine, it's a bit behind compared to retail or other industry verticals where data is more easily flowing across the organization. But we are very close from an enterprise data harmonization perspective. So I would talk more on that because that's basically comes directly under my responsibility as well. So globally, we are consolidating most of our back office data, including finance, manufacturing, sales, CRM, commercial, into the global data lake, data warehouse architecture, right? So this is where we are, in a way, addressing a lot of our organizational needs.
That's really, so kind of understanding where you are today and where you're planning to go from a digital point of view and how you're sort of enabling the talent, as I call it, unlocking the smart talent in organizations. by giving them the tools to be creative and imaginative in what they could do with data.
Absolutely.
Really, really powerful, the opportunity we have, especially aligned to the mission Sanofi has from a humanistic perspective as well. So I think that's really sort of key in where you're at. Now, as we see organizations and just sort of current changes in data and analytics organizations, and generally IT and the tech sector, we're not very inclusive and very diverse in some of our organizational models. And so how do you attract kind of inclusive and diversity within Sanofi?
That's again, a very key point given the day we are living in, right? I would quote our CEO, Paul Hudson, who recently said that we have to ask ourselves, do we have a workforce that is reflective of the society we are living in, right? And if not, why not? And we take this as a top priority. Sanofi has a very strong view in terms of inclusion and diversity, which is core to our purpose of improving human life globally. Keyword being human. Data analytics and data science are levers with which our leadership is not afraid of using to ensure we have a truly inclusive organization. So, what needs to be done here is simple. It's not a complex thing. It's not rocket science. We as leaders must take it upon ourselves to act at all levels deliberately in the company to close that gap between what is said and what is the actual impact, right? So the era of diversity as a checkbox somewhere is over. We can't do that, right? We really have to make it real. We need to be enabling equality of opportunity, through fairness and transparency. So, as per one of the recent studies that I was just reading from McKinsey, organizations with proper gender diversity on executive teams were 25% more likely to have an above average profitability than companies in the other fourth quartile. So, and yet, the representation for minorities remains on an average below 30% for gender and below 20% when it comes to ethnicity, right? So, diversity doesn't guarantee inclusion, and this needs to be factored in when designing a truly complete organization. Having said that, coming back to healthcare and in specific to Sanofi, we are much ahead in terms of diversity when compared with other industries, honestly. And in healthcare, in Sanofi, we try to make sure that we do not have the gender gap in promotion rates or compensation, unlike other industries out there. So our goal is to reach 50% representation of females amongst senior leaders by 2025. Today, we are, in our complete workforce, we are about 46% of our workforce being female. So we are leading the way in those areas, and we need to see how we continue to evolve and continue to give that opportunity at equal levels globally.
Yes, well, the first thing is measuring it,
yes,
and understanding it, and enabling it.
Absolutely.
I always see diversity in the teams I've led or been part of.
Yes,
really
and
the genesis of creativity. So
absolutely, Bas. And just to just to give you one more point is just in my team, including externals or partners and my own direct reports and others that we have a team that represents 20 different nationalities. So, you can imagine if you go out for a dinner or a, get together, it's like amazing to talk with people with such diverse cultures. And the program that I'm working in, we have more than 30 different nationalities represented globally. So it's an amazing experience, a lot of learning that comes out of that as well.
That's good, really good to see. And say, when you've got that level of diversity and thinking in the problem-solving challenges we have, or some of the challenges we have in organizations, the ability to be creative around it is enabled there. So it's really good to see that.